talking to you today about epilepsy and COVID-19. Let's start off by talking a little bit about COVID-19. The coronavirus is a disease caused by the virus called SARS-CoV-2, or Severe Acute Respiratory Syndrome Coronavirus 2. The virus spreads mainly through the air by droplets from sneezing, coughing, and even just talking. These droplets can also linger on surfaces and spread by touching the surface, then touching the face. If you or your loved one has a diagnosis of epilepsy, that alone does not increase the chances of getting COVID-19. And if you get COVID-19, having epilepsy alone does not mean that you're at risk of developing severe disease. However, if you have epilepsy in addition to other underlying medical conditions that have been known to be associated with developing severe disease, the risk is higher. Underlying medical conditions associated with higher risk include diabetes, high blood pressure, heart disease, impaired immune function, and older age. If you have a type of epilepsy that requires treatment with medication that weakens your immune system, you are also at higher risk of getting COVID. It has been shown that those with intellectual and developmental disabilities may also be at higher risk for getting COVID because they may be living in group homes, have caretakers that come in and out of the house, or may be unable to maintain the mask or adequate social distancing. COVID-19 affects all ages, so children with epilepsy can also get COVID. However, the risk of getting COVID is not higher because of having epilepsy. Those with intellectual disability and developmental delay may also be at higher risk for the similar reasons that we described in the last slide. If children get infected, it has been found that those between the ages of 1 and 20 tend to have milder symptoms. However, some still can get severe symptoms, especially if they have underlying medical conditions. Infants also may be at higher risk for serious disease. If you get COVID and you have seizures that are triggered by fever, make sure that you treat the fever. Medications for upper respiratory symptoms like decongestants and antihistamines can aggravate seizures and should be used with caution. The other concern for someone with epilepsy who contracts COVID-19 is that some of the anti-seizure medications may have drug-drug interactions with medications that are used to treat symptoms of COVID-19. If you contract COVID-19, your doctor will need to assess the risk and benefit of prescribing these medications to you. If a person with epilepsy gets infected and has severe symptoms from the virus, such as heart, liver, or kidney failure, it may change the effectiveness of the seizure medications, requiring adjustment of doses or changes in the medications used. In those with or without epilepsy, severe cases of COVID-19 can result in systemic derangements like hypoxia or electrolyte imbalances that can lead to change in mental status or even seizures. At this time, however, there is no evidence that the virus itself causes seizures. There are some patients with severe disease who develop seizures because of significant systemic changes that occur from critical illness. The long-term consequences of COVID-19 is unknown, however, and we don't know if having seizures while being sick with COVID can lead to future seizures or epilepsy. The best way to prevent getting sick from COVID is to take the recommended precautions that are set by the CDC and your local authorities. You should talk to your doctor if you have specific concerns, and if you have underlying medical conditions that place you at higher risk, make sure you're getting treated. Take appropriate measures to minimize your risk of exposure, and get the vaccine to help prevent infection and minimize disease severity. We recommend that patients with epilepsy get the COVID vaccine, particularly if you take medications that weaken your immune system. Currently, there's no evidence that having epilepsy places you at higher risk of having side effects to the medication or the vaccine. If you have had allergic reaction to vaccines in the past, you should speak to your doctor about this, as you may not be able to get the vaccine. The vaccine itself is not thought to cause people to have seizures, but those who have seizures due to fever may experience breakthrough seizures if they develop fever after getting the vaccine. If you are worried about developing a fever after the vaccine, talk to your doctor about ways to prevent fever or how to treat the fever or seizures if you have one. Importantly, currently, there's no evidence that the vaccine itself causes seizures, epilepsy, or brain damage, and there's no evidence that the vaccine interacts with seizure medications. Other than getting the vaccine, there are ways to prevent getting seizures. Make sure that you're taking your medications regularly and that you have an adequate supply. See your doctor regularly and make sure that you're taking good care of yourself. I also want to mention that other than the effect of the virus itself, COVID has had numerous impacts on patients with epilepsy, and one important one is mental health. These have been challenging times for everyone, but patients with epilepsy also often suffer from depression and anxiety, and these symptoms may have been heightened during the pandemic. Symptoms of depression and anxiety can include difficulty sleeping, stress, and missing doses of medications, all of which can lead to increased seizures. It is important to take care of yourself during these challenging times and talk to your doctor, employer, or family and friends for support. Make sure that you're taking medications to treat depression or anxiety and that you have adequate supply of your medications. Make plans with your family and friends or other support systems for backup in case your primary caretaker falls ill or is unavailable. To prepare for the possibility of having a breakthrough seizure, you can plan ahead and come up with an emergency plan with your doctor. Learn about your seizures and let others know how they can help you if you have one. Know that most seizures last under 2 to 3 minutes and don't require emergency medical services or hospital care. However, it is very important to know when you should get medical attention, such as seizures that are lasting longer than 5 minutes, seizures that are occurring in clusters, or any seizure that is unlike your typical seizure. If a seizure happens in water or the seizure results in serious injury, please seek medical help. We are here to support you, and there are many ways to get help. If you have questions or concerns, you should always contact your healthcare provider. And because we now know how to protect ourselves better from this virus, we encourage you to get timely, routine, urgent, and emergency care when you need it. Thank you and stay safe.